Good morning, Hari, and welcome to our Sabr podcast. Uh, I'm happy to have Shaima from the Sabr Collective with us. Uh, my absolute delight in having Hari over is because we met last month at the Médecins Sans Frontières Scientific Days workshop at Colombo. And it's been wonderful to learn about Hari's work. And I'm going to briefly introduce that in a moment. But Hari has recently started work as a junior research officer at the International Institute of Population Sciences. Congratulations for that new role, Hari. And Hari is a public health professional with a master's in public health and a B.Tech in civil engineering. And his interests that he's been exploring through his public health work has been on loneliness and social isolation and how they influence health and well-being across life stages. And what has been fascinating for me is, as somebody who's also got an interest in Kerala in particular, a lot of our work has tends to be around questions of, at least my own work has been on questions of uh, terminal illness, chronic conditions, a lot of questions around end of life care. But this part of these factors which shape health and well-being sometimes elides our attention and we just don't end up attending to it. And in particular, you have an interest in looking at young adults and how they've been, you've been looking at questions of loneliness and social isolations as they shape young adults' lives. So this has been fascinating. Your work, as you presented it, was also of an interesting format. So we've been really looking forward to talking to you at Sabra on your work. And welcome, and thank you so much for joining us for this conversation.
Thank you so much for having me here, and it's an honor and delighted to have this conversation here and just see how, let's have a wonderful conversation about each other's perspectives. That is what I'm looking at, rather than a one-way thing. You can pitch in, and Shaima can also pitch in, and let's see.
Thank you so much.
Sure,
Love-
Hari. Yeah.
Yeah. So maybe if you could just begin with telling us about yourself a little bit and, about how you got interested in this question of loneliness and social isolation, perhaps. Yeah.
Sure, definitely. So I am based in Thiruvananthapuram in Kerala, and like Devi introduced, I had done my undergraduate in civil engineering, following which I worked in the solid waste management sector for 2.5 years. And at one point, I felt that I need to do something else, and then I got thinking about, okay, let's try a post graduation, but definitely not engineering. So then the choices that I had was public policy and public health. And I'd given the exams for both, and I managed to get into the public health program at Sri Chitra Tirunal Institute for Medical Sciences and Technology. It's a national importance organization of the central government located in Thiruvananthapuram. And as part of the curriculum, we are supposed to draft a thesis. Uh, with a primary data collection, you are not you are excused in some cases where you work with technology to use secondary data, but otherwise it's primary data collection. And this topic, which is exploring loneliness and social isolation among emerging adults in Kerala, was the one I chose for my thesis. Emerging adults refer to an age group between 18 to 29-year-olds. And this term has been coined by a psychologist, Jeffrey Arnett, who works in Clark's University. And he believes that this age group is particularly important because it's more or less like a transition from our adolescence to adulthood. And there is a lot going on during this period which needs specific recognition and needs to be treated as a part in one's life independently. So, but when you look at the studies into emerging adults, it's just picking up. It's picked up pace in Western countries, but not so much in LMICs and Southeast Asian regions. So, why I became interested in this topic? So, in the latter part of 2023, WHO had actually recognized loneliness and social isolation as global health concerns. And they put out a need to study these in different varying cultural contexts. And I just read the article and I left it there. A personal incident happened afterwards, wherein I was with a bunch of my close friends and we were having this get together, and one of them remarked in between to me that he's feeling lonely. And it was very surprising to me because this was a circle which is close for me as well as him. So for him to feel that way when all of us are around, I asked him, okay, what's up? What happened? And he was saying that I'm not able to relate to the conversation. I'm not able to fit in with the kind of conversations that is happening there. And I listened to him and I consoled him, and that ended there. But then it got me thinking about, okay, so why would a person feel lonely when he is or when they are with their closest bunch? So the next day, I happened to talk to a professor of mine, and he asked me the same question. So just think about yourself. Do you feel lonely only when you are by yourself, or is there a possibility that you also feel lonely when you are with other people? And that got me into introspection. And I found out that both cases are plausible. You can feel lonely when you're by yourself. You can feel lonely even when you're midst a crowd, even when you are with your closest people. And that actually, got me interested in this topic. This is not so simple as it feels like. It's more nuanced. And then I, put on my researcher hat and did the obvious thing, which was go into reading literature based on loneliness. And then I came across another term called social isolation, which would be a more objective measure of this, wherein people are socially isolated when the quantity of persons in their lives is lesser than what they think is ideal. So it's an objective measure compared to loneliness, which is subjective. And a plethora of studies have been conducted on loneliness and social isolation in the older adult population. It's very much studied, especially, and you might be knowing better because you deal with palliative care and end of life care. So, how older adult population feel lonely, how because of obvious reasons they are separated from their family, they suffer from bereavement, they lose their partners. So, all of these add to a loneliness in them, and it has been associated with a lot of health parameters such as cardiovascular problems, especially dementia, as well as dementia in older adults. But when you come to the younger adult population, studies are just picking up. And it's more concentrated in Western countries such as USA, UK, European nations, and Scandinavian nations. Whereas multiple organizations, including the WHO, state that this might not be a problem in individualist cultures like these. It might equally be a problem in collectivist societies such as ours. But then you need localized studies to understand the problem first, following which you can move to the next step. So then I zeroed in on this. Okay, what I'm going to study is loneliness as contextualized or as explained by emerging adults in India, and this would be the first step towards conceptualizing loneliness. So we can think about measuring loneliness, its prevalence using scales validated and developed in the Western context. But how much of it is valid in our context is the first question to ask. So that is what got me working on this topic. And specifically Kerala, I chose because, so not just because I am a native of the state. If you look at the demography, it's very much comparable to that of countries like UK and USA. It has the lowest total fertility rate in India. And when you look at the type of families here, it's undergoing a trend of nuclearization. So individualization as a value is also picking up pace in a state like Kerala. It is one of the first states to demonstrate migration. So a lot of youth, especially in this age group of 18 to 29, is migrating elsewhere for education as well as work. So they're severed of their roots, friendships, families, all these things, all these. And if you look at it from a negative lens, according to the National Crime Records Bureau, the state has one of the most higher suicide rates among this age group. And if you look at, so if you just remember the news in late 2023 to early 2024, there was a lot of crimes in this age group related to violence, risky behavior, and substance abuse, and even violence to your parents and family members in this age group. So I felt that it would be a good, sample population to look at, considering the backdrop there. So this is a summary, a long summary, sorry for this, of why I actually took this topic.
Thank you so much, because I felt like there was so much clarity in the way you explained it, although I'm sure, there was a far more sort of reflexive, iterative process of going through the study. But so
Hmm.
many interesting elements that you flagged. Uh, to begin with, saying that it's the WHO's, WHO flags this as a global health concern, but also the fact that we cannot consider these as similarly located in different geographies. How you also bring in this distinction of Kerala, in the sense that Kerala has its own context specificity, both in terms of demography, but migration. You bring in the question of migration, also the suicide rates among this particular population. So many elements to think about and also explore. But I wanted to just touch upon that point which you said, which is that we tend to be classified as these individualist versus collectivist cultures, and this is yet again one of those moments where we see this is such a myth, isn't it? And the idea of a collectivist culture where and you say that even among groups of people you can feel lonely, so or these break down into more individualized forms of interactions, right? So just wanted to kind of revisit that for a moment and
Mhm.
stay with that. Um, I was wondering if you could tell us how you moved from this exploration, from this understanding that this is something that needs further inquiry, into how you started actually reaching out to people. What were some of the uh, how who are your interlocutors? What did they say? What did they finally tell you when
Mhm.
you started interviewing people?
Mhm. Sure,
Yeah.
sure. I conducted this as a pure qualitative study
Hmm.
with an inductive approach, which means
Yeah.
that I didn't keep any sort of a lens in my,
Sure.
ideological, I mean, theoretical backing.
Yeah.
Um, Everything that they said, I accepted as it is. So,
Hmm.
and the first step was to just interview a couple or 3 to 4 of emerging adults, any persons who were within this age group and willing to give me interviews. I interviewed them, and I got certain perspectives from them. And then the sort of a sampling approach I took. So wherein so I'll substantiate it with the help of an example, probably. So the second interview that I did, that was with a male participant, and
Hmm.
he got into a very stable kind of a career at an early part of his 20s. So, why he felt lonely,
Hmm.
and he felt lonely mostly because he migrated to another place, and because specifically because of his workplace conditions, wherein his workmates were mostly women who were from a higher age group than him, and so the priorities that they had and the topics that they discussed were very different. So you had a bachelor who was in his early 20s,
Yeah.
starting off a work, and your colleagues were people who talked and discussed about how their children were and what kind of
Yeah.
diseases and issues that they face because they had little babies, and he couldn't relate to this at all. Um, so then I made it a point to see how the perspective of a married woman would be. So the next participant I sought
Hmm.
was somebody in this age group, but a married woman, to
Interesting.
see how that perspective would be.
Yeah.
Right. And then, the first 4 interviews that I did were people who belonged to nuclear families. So the fifth person I interviewed was a person who belonged to a joint family because I felt that that would bring in another new perspective.
Sure.
Right. And so this process was iterated completely throughout until I felt that saturation was attained, which means that the perspectives or the points that the participants told were recurring. So until that point, I kept on iterating this.
Hmm. And can you tell us a little more about what is it that they were sharing with you? As in, what is it that resonated? What is it that sort of mirrored what you saw in your literature, but or perhaps what caught you by surprise in what they
Sure,
were?
sure.
Yeah,
Yes, so a lot of theoretical underpinnings were also validated through my study. So loneliness could be because you, just like I stated earlier, the quantity of persons in your life being less than what you consider ideal could be a reason for loneliness, which is also validated in my study. Equally plausible is having an emotional loneliness, which means that you have people in your lives in terms of quantity, but then you might not have a person who's close to you. So, say a partner or a very, very close friend whom you can be vulnerable with and share your emotions, however negative they may be or positive they may be, and they won't judge you. That kind of a close connection is not there, and that would cause emotional loneliness. All these are part of theories, and all these were validated from the kind of inputs that my participants gave me as well. The coping mechanisms as well. So, a lot of literature in the West states how these young adults indulge in risky behaviors. So, even something as simple as rash driving is something that people talked about and has been found in Western studies and equally in my study as well. And another is with respect to substance abuse. So this has been found to be something that persons resorted to, especially in the case of social isolation, because they wanted to numb themselves. And I'm not talking about just alcohol or cigarettes. People talked about smoking weed and other illegal substances as well. So they wanted to numb themselves from the kind of negative effect that this loneliness and isolation was causing to them. So substance abuse was also something that mirrored the findings which we find in Western countries. But there were quite a few surprises as well, which I found out. So the first being, so like I said, I did talk to married women. Right. So so then there was this conversation. Then I sought to find women who are married and don't have kids and who recently delivered. So both, I interviewed both. And the loneliness in pregnant women and new mothers was something that I didn't see in literature at all. I didn't anticipate, nor did my guide. So that was something interesting that came up. And one of the peculiarities is that one pregnant, I mean, she is a new mother, but she is a doctor. So she knew correctly how to distinguish postpartum depression and this. And she was very sure that loneliness during pregnancy and motherhood is different from a postpartum depression, and both should not be treated equally. So, uh, pregnancy and motherhood, why it introduced this sort of a loneliness is because you didn't fit into that category of women that you previously belonged to. You were looked upon as a pregnant lady or a mother, which puts yourself into a whole different category,
right.
which keeps you out of certain conversations and certain kind of events outside because you are in a sort of I don't know what word to use, vulnerable, but yeah.
Sure.
So that is one. Secondly, there is a lot of transformations you are undergoing. It could be physical and it could be mental during pregnancy, and you couldn't relate this to anybody else. Sure, your partners were there, but the maximum that they could do is empathize with you.
Sure.
This sort of embodiment that is happening to you
Hmm.
could not be something that they could relate with, and this actually made them really lonely. The
Hmm.
only people who could understand them and relate to them was other pregnant women who were also undergoing difficulties of pregnancy, so they couldn't reach out to them. So it
Yeah.
was more or less a helpless situation.
Hmm.
Um, and then once you deliver as well, a lot of changes undergo. So during pregnancy, you are the center of the family, like you are pampered and you're cared. And once the baby is delivered, all the attention shifts to the baby. And this is not something that is very easy for everybody to process. And that actually made you feel lonely as well as isolated, because your family, people who came to see you, you suddenly change. It all shifted towards the baby. And I'm not talking about this in a negative lens, but when that transition is sudden, it would be hard to process that, especially because you are having so much of changes in you over the period of, 9 to 10 months. So again, this would be a problem. And finally, there is a lot of culturally sanctioned isolation because of pregnancy and motherhood. So,
Right.
cultural sanctions that state that the mother and the baby should not leave the house for 40 to 45 days post delivery. And this is stating that it would be good for the baby and mother not to be outside and, be exposed to other pathogens and other undesirable elements, which is, of course, true. But then you're talking about a person. How much of this would affect their mental health? That is not given any consideration here. So, socially sanctioned isolation is also something that, made them isolated. And finally, procedures such as the C-sections meant that you couldn't literally get out of bed for a long time. So, again, you're isolated. So, there is this whole area of isolation and loneliness centered around pregnancy and motherhood, which is not substantiated in any sort of literature, where there is minute literature that looks into this. So that was something very surprising that I found. And secondly, almost all participants were able to distinguish this positive sort of loneliness that they felt, which they classified as being alone, which and that is different from being lonely. Being alone is something that they sought, and it's like a need. It's self-sought solitude, because you need to recharge your batteries post a lot of socialization. This is a peaceful place for you to go to. You work on your hobbies, something that gives you positivity, and it's actually a very good place. And this is totally different from loneliness, and participants were able to distinguish this very well. And The third being a sort of coping mechanism, which I felt was very interesting, because usually all the narratives talk about how human connection is very important to cure loneliness. And I personally believe that that works for me as well. But then what happens when you can't reach that, when you don't have that? And a lot of participants actually used AI chatbots as persons for, coping with. So they
Yeah.
had a conversation with the AI chatbot, and this they found to be an interesting coping mechanism. So there is
Wow.
a lot of debate happening around
Yeah.
whether AI is useful or not, and that's a discussion for another day. But then
Yeah.
I don't think you can leave out AI
Hmm.
in the future. So if this turns out to be positive for some person, then who are you to say that it's not, right?
Hmm.
So that is something interesting that I found, and I mean, let's proceed from this,
Yeah, no,
and
this
let's
is
hear from
so
you as well.
no, this is so fascinating because I mean, especially I mean, for me, it was unexpected, the question of women who are pregnant or early, I mean, young mothers in that sense, and then talking about loneliness among them as one category that you found worth attending to, but also this AI thing is completely, hit
True.
out of the field. So, just trying to come back to some of these questions of how people, but of course, I mean, I appreciate the fact that people would seek alone time, right? Like solitude, and that has a different valence compared to loneliness. And I think that's an important thing that we need to register, and that you corroborate that in many ways, right? And your participants say that they do seek this out. Um, and also the fact that it's not just the number of people, there's this notion of emotional loneliness. Did people talk about why, what was bothering them, in the sense that you mentioned at some point that they were struggling to cope with, right? In the sense, especially when you were referring to the substance abuse question. So you said they were struggling to cope with loneliness, but was there something which is, any indication of other underlying issues? Loneliness is one factor. I'm wondering if I'm able to articulate this. But for example, if is it about the larger, social fabric within which one is embedded? For example, is it the nature of employment or the nature of the education system, or the nature of the family structure? I'm just wondering if there was any kind of nod towards that, or was
Got
it,
it, got
or
it.
was loneliness like an endpoint in itself? I'm
Okay,
just wondering. Yeah.
Yeah,
okay.
I have a point to add to that.
Sure, sure.
So,
Please.
am I
Yeah.
audible?
Shaima,
Yes, you're audible.
losing you in between. Like, I think there's a little bit of a
Am
lag.
I audible? I can't hear you.
Yeah, you're audible, but I think we
I
lose you.
think it's my internet. I
Mm.
can't hear you. I'm sorry.
That's right. Shaima, maybe if you could turn off the video, uh, that could maybe help.
Yeah. Is it better now?
I think so. Let's try.
I know. So I just wanted to add one point to that, what the ma'am is telling. So it's that you also mentioned the loneliness is a very subjective. What I'm thinking is some individual they may not even recognize like what are the primary calling this as epidemic, because I somewhere I read it is as hazardous as smoking 15 cigarettes a day. So so how do we study? I mean, how do you understand from maybe from your research or literature? Have you come across how people who don't even recognize they are lonely, and what could be this reasons, the larger, broader reasons for this?
So the question is, what about people who do not recognize that they are lonely?
Yeah. Do you have?
Yeah,
I think that's what I understood as well. Yeah.
Okay, okay, sure, sure, sure. So I'll start with the question that Devi posed. So this is regarding loneliness and the coping and whether it's an end in itself or are there larger underlying factors to it. So I'd like to make a distinction between the kind of coping for loneliness and social isolation to start with. People found that they can deal with loneliness and they wanted to deal with loneliness. They wanted to put in effort and they did put in an effort to cope with loneliness. So this included activities such as engaging in productive activities, your hobbies, spiritual activities, talking to friends, or just giving it time and indulging in self-care, and also seeking professional help. But when it came to social isolation, the coping mechanisms were more of negative in nature and indicated idioms of distress, which we use in qualitative research. So distress signals which varies based on cultures. So for example, a person who was abandoned as a child and who grew up as an orphan, she always seemed to have verbal fights with her heart partner. Other people threw things, especially in the kitchen. Many people cried, and like I mentioned earlier, a lot of persons also sought to use illegal substances to numb themselves of the pain. So this was the sort of coping mechanisms that you found in social isolation, in contrast to loneliness, where people were more, they wanted to cope with that, right? So and this then brings in what is fundamentally different in isolation and loneliness, which makes people do that, and that is where I feel that all these structural factors have a role to play. So the reasons for social isolation, which my participants highlighted, the one of them was this abandonment. So a child that was born out of a wedlock, she grew up as an orphan, um, and she suffered a lot during her childhood, including abuse in the orphanage where she was, brought up. So all these then built onto her. thoughts and how she perceived the world. And that actually, uh, so that again talks about the underlying structural factors. So, orphanages, are they regulated? How much? And then the aspect of poverty she had to do. So she works as a waste management worker. So how much of education is available to them? Is there checks and balances which see that all these orphanages are regulated and they do not resort to things such as abuse? So things like that come into play. Second person who was isolated because of his identity as a gay man. So that talks about the larger heteronormative society and how that actually sees homosexuality as a crime and how they try to bypass it. So this person was pressured into a he is still pressured into a heterosexual marriage. His cousins have completely isolated him, but then they go behind his back and pressure his parents to get him into a heterosexual marriage. So these are indirect forms where you isolate them and then pressure them,
Yeah.
right?
Yeah.
Another person, because he was an atheist in the family, and whereas all his friends, all his family were believers. So this was so any sort of involvement with him would be then perceived by the community and the religious bodies as in his own terms, allowing a non-believer to grow, which would be against their sort of beliefs and ideal system. So again, this is how something as structural as religion plays into isolation, right? And then fourth is a linguistic and migrant identity. So you know how I mean it's very shameful that our society, one such as Kerala with such a high literacy rate, still
Mm,
tags everybody as somebody from North India comes, he's automatically tagged a Bengali,
mm,
right? So
mhm,
this kind of calling people by these names and not giving them a sort of treatment that they are that they should be given, especially regarding services. So the migrant workers whom I talked to were telling me that they found they couldn't get a local SIM here. They were excluded from that, right? So
mhm.
these are all the underlying structural factors which then play into isolation.
Yeah.
Not so much in loneliness, but a
Yeah.
lot in isolation. So I think all these are intertwined. You cannot take anything out of each other. And
Yeah.
this actually exacerbates the way people experience isolation and loneliness.
Absolutely. Uh, so that's a lot of social groups who are represented in your study, isn't it?
Mhm.
Can you tell us a little more on that? So I hear you talk about people who are from different social classes, also from different, the not all of them are Malayali, some of them are migrant workers. You also talk about gender diverse social groups. So any kind of specificities there in terms of uh, how loneliness was experienced? You've already talked to us a little bit about how
Mhm.
these were experienced differently, but did you pay attention to these question of social groups in this work, or is that something you intend to take forward?
Mhm. Mhm.
The
Yes.
differences across social groups is what or the specificities, the particularities about social groups when it comes.
Yes, yes.
Yeah.
Got it, got it. So, so the social groups, so everybody or most of them the causes of loneliness for them were very different. So that is one thing that I found out. For a migrant, it was being away from their family, which is elsewhere, and the sort of connectivity issues that I talked about, and them not having so we have a lot of natives have a lot of avenues that they can go to and vent out, right? So you have your close circle, your family, or even people, what people termed as safe spaces, like a temple or a beach where you can go and find some peace, or even seeking therapy. So all these things were accessible, but that was not possible for a migrant in a state, in our state, right? So that was one of the reasons why they felt lonely. Whereas if you talk about yeah, I'll talk about a major gender-based difference that I found. So I had around 15 participants female and 15 participants male, counting the number of people I did interviews and group discussions with. And all 15 out of 15 women admitted that they cried when they felt lonely, right? And whereas only 1 out of 15 men that I interviewed admitted to the fact that they cried, but they always said that they felt intense, sad, and every other feeling that they associated with loneliness was common, except for admitting that they cried. So, is this because of a gendered norm that men don't cry, or because they felt that it would damage them admitting that to me, who is another man? Right. So that is how a gendered sort of lens gave me an interesting perspective regarding this. And before we just proceed, I forgot to, um, uh, answer Shaima's question regarding recognition of loneliness. And
Yeah.
so, Shaima, a lot of people, it was so loneliness. So, imagine that we are not talking about this at all. And imagine that I am requesting you to have an interview with me. And if the first question that I ask is, what do you, what do you think loneliness is? It's such an abstract question for you to answer, right? So, for all the participants, it was necessary for me to get them into that position where they are ready with, what loneliness is. So I began with something called a grid elaboration method, which would essentially be a grid, which would be four grids like this. Oh, I think it's being blurred out. So you have a
Hmm.
four grids, and in that I request them to so first think about what comes to your mind when you hear the words loneliness and social isolation. And then fill in the four grids, what you associate with. It could be through any medium that you feel that you like. So words, stories, poems, sketches, anything that you like. And I requested them to do this at least 3 to 4 days before the interview so that they are in the space. And we began the interviews by elaborating on what they filled in the grids. Right. So some persons might have written about the emotions that they feel when they are lonely. Some others would have written about the situations which put them at lonely. Some others the coping mechanism. So we started through that. And so I ensured that they are in this place already, whereby they have already thought about it. You know,
Okay.
that is something that I did. Otherwise, it's very hard to just
Yeah,
extract that answer just like that, unless you are, too much into that topic.
that's what. Even if they are feeling lonely, people will not open up. That's what.
Exactly. And that
Yeah.
is why it's necessary as a qualitative researcher to listen. You listen a lot, and almost all of the interviews, on an average, ranged 1.5 hours. So some
Mhm.
went beyond 2 hours. So sometimes they might deviate altogether from the topic and talk about something else. But then it's your job to bring them back. And some persons got into the zone and started talking about loneliness in 10 minutes or 15 minutes. Some other persons took probably 45 minutes to 1 hour. So it ranged. So you have to be patient as well.
Of course. Also, after that, I wanted to ask, um, how are our public health system support this? Like, what is the um, how they are addressing this loneliness issue, and what are the strategies they are bringing up? I mean, how it is
Right,
supporting this health?
right. To be frank, I don't think the public health system is addressing loneliness at all. Even if you take the case of Kerala, which has one of the best public health systems in the country. Yes, you have, and under the RMNCH program, you have a counselor, you have a psychologist in primary health centers and all the other healthcare facilities upward. Yes, that addresses one aspect of it, but then something to dedicatedly address this is not there in the public health systems. But then, if you look at the larger community, there are a lot of things being done right now. So, for example, I read this article around 3 to 4 months back, which was on community level activities which look to bring in a sort of, what do you say? fraternity together so that people in this age group do not feel lonely. So they create different avenues. So something could be a running club, another could be a walking club. So these people meet at regular intervals, even a book club. So
Mm.
meeting like once a week or twice a week. And they actually introduce the city to these new people, somebody who's migrated. All of us have the opportunity to join these clubs. And then they sort of create avenues whereby other things of the city. You are able to connect with other people of your age group, and sort of it eases the process of settling into a new area. So
Mm.
migrating to a new area and building your roots, building your foundation there from scratch is a very hard process. And if you have groups like these to facilitate that, right, that is something that eases up the process. So this was regarding a running club in Kochi. I do not remember the exact name of the club, but then there are activities such as this being held. And even in Trivandrum, you have something called Trivandrum Reads. This is a book club that which meets in common areas like the government playgrounds or open areas or museums every week. So if you are a reader, you can reach out and you can go to their meetings, and it's one another area for you to connect with like-minded people, and for you to understand that yeah, you are not alone here. You have other people with similar interests to whom you can go to and find that find that positive space, right? So avenues such as this are being created, and a lot of discussion is also happening around loneliness and isolation, I guess. Newspaper articles are talking to psychiatrists and psychologists, and even youngsters who initiate such interesting avenues, and putting it out there. So this aspect which I talked about, the running club, this was a larger article which was published in the Hindu. And the Hindu itself has published around 5 to 6 articles on loneliness, and the need to recognize it. So a lot of discussion is also happening in this regard. So I think it's an initial step. It's a welcoming step for us to recognize these. But then the public health system and even the national mental health care policy, not even one mention of this is there. But hopefully the next one would take care of it, considering that such a good discussion is happening around this.
Yeah. So the reason why I asked you this question is that during one of my interview with an ASHA worker in my around my place, she was mentioning she used to reach out to the people who live lonely I mean, they are living alone, or I mean, she was talking about their mental health issues they are addressing. So
Hmm.
I mean, when you talk about this, I thought that maybe they have already started on that
Um,
level, the panchayat
yes.
level.
So I forgot about that. So I was completely thinking about about my age group. But if you look at the other age groups,
Yeah.
yes, definitely. So Devi is a better person to talk about this. So the palliative movement in Kerala itself, even I have been part of some of the activities, and we have something uh, where the community is part of the palliative care movement, right? And one of the palliative somebody who's seeking palliative care, when I talked to him, he said he's a champion for palliative rights. So he told me how certain people do not want much. They have been bedridden throughout their life. So what they want is probably to be able to sit in the front of their houses and talk to a few people.
Yeah.
And the community actually does that. They come together and enact and then help. So even school children are volunteers for this. College children are volunteers for the palliative activity. So addressing the loneliness and isolation among the older adult population, definitely yes, and a huge part of that is played by the palliative movement as well. So in that regard, definitely yes. But when you talk about the emerging adult population or young adult population, not so much.
Yeah. Yeah. Got it.
No, that's so much of all of this is so fascinating, this conversation that just happened, because it got me thinking about the fact that ASHA workers, and it's so difficult to also kind of box the work they do, right? So when
Hmm.
you're reaching out to the front lines, you're also extending unasked for, but some kind of you're bridging this question of loneliness, even if that's not part of your strict job description in a very
True,
instrumental way,
true.
right? That on one hand, but on the other hand, also looking at the question of palliative care and how, of course, at the uh, care receiver's end, you can see that some of these questions. This was in fact one of the early felt needs, right? That
Hmm.
social isolation was where the community came in, right? The question of isolation. But I'm also thinking about it because there's a huge students in palliative care movement in Kerala, SIPC, as they call it, across states. And Trivandrum is actually one of the sort of weaker linkages here. But
Hmm.
Malappuram side, etc., it's very strong. There are in Wayanad, etc., there is I think I remember this place that I went to, which had around 400 young adults who were part of this one clinic, at least in their registered numbers. But I'm also thinking from
Hmm.
their perspective, this is a great, I can now see that there's a kind of space to come together. Another reason for them to come together, right? I'd always be curious that why are these young people coming and working in a space of so much suffering, isn't it? Like physical suffering, social suffering. But that gives you, and I'm also therefore wondering. I mean, you talked about these reading clubs, but some of it requires an individual to come out. If you're already
Hmm.
feeling loneliness and social isolation, it requires again you to take that effort to come out and be part of something like this. Whereas if there are already some forms of structures that make it a little more easier for you to
Hmm.
get
Hmm.
absorbed in. Um, so again, this question of how larger social structures can enable or tackle social isolation.
I
Right.
think that's a very relevant point because, yes, not everybody is comfortable taking an initiative by themselves. So, I had a couple of experiences. One male person whom I talked about, he said that he has never talked about all this to anybody else ever in his life, right? And even the person that I was talking about earlier, who was abandoned as a child, she told me that it's probably the first time I'm talking about all these and opening up to a person. I've not even talked about this to my partner. So, yes, there are people who are, wary about reaching out. So, how do you bring about them to the limelight? How do you extend this to them? Is yet another question that is to be answered, which I think is something. I mean, I don't have a clear-cut answer to that, and I feel that. That is where the larger social fabric and social connections, building and investing in connections, all this actually is a need. As people, I think that's something that we have to recognize and put in a lot of effort ourselves, maybe because uh, it might be too late to recognize that you don't have anybody in your life, but it is a need, and I don't know how to do that. I don't know. I don't have answers as to how to facilitate that. But importance of social connections, building it and maintaining it. That is where all these comes in. I don't know how much system can implement that. So it's not something that it's like a top-down, approach, right? It's something that has to come from within, as
Yeah.
communities, as friends, as
Yeah.
family, right?
Yeah.
So, yeah, not at all an easy questions to answer.
Yeah, no, absolutely. And I think I agree with you that some of this I mean, of course, going to Shaima's point on what do mental health systems do, I think this is important in terms of, say, if you need access for a substance abuse, or if there are
Hmm.
questions of needing access to a psychiatrist, a
Hmm.
trained professional is what I'm trying to get to. But
Hmm. 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 Hmm.
otherwise, the solution for this, it'd be interesting to see how it is more bottom up, collective in that sense,
True, true, true,
collective
true.
responses. And uh, great. So, Hari, one question that I've had throughout this conversation is whether you noticed anything around the role of phones and this experience of, social isolation and loneliness. So, I was wondering if you'd like to share something about that from your study.
Definitely, yes. So, multiple participants remarked that the quality of conversations decreased after, the hype of social media and the social media usage. Quality conversations are very few. You have people responding through emojis, which is not what some people want. And this actually made many of them feel lonely because you put yourself out there, you express yourself, and then finally, if from the other side what you get is an emoji, it doesn't make sense to a lot of people, right? So definitely it has decreased the quality of discussions and conversations and relationships. Secondly, social media also means that you have abundant examples to compare yourself. So if I am a lonely person and I see people uh, around me going for holidays and enjoying partying together, then I am bound to compare my life with theirs. Which would again put me,
Sure.
which
Yeah.
would again exacerbate the loneliness that I
Yeah.
already have,
Yeah.
right? So,
Yeah.
in that sense, social media also exacerbated this feeling of loneliness. But then there were other people who made use of these avenues as well. So,
Mm-hmm.
um, say people in different time zones. So, a person in another part of the world, he or she would love to use social media to connect with their roots, their families here. So, I think it depends upon the persons, but I mean, I have had responses which vary to both sides. People have
Mm.
found it to be negative, as who have used it for other venues as well. And then, just like I was telling you about how people use AI chatbots as well. So,
Yeah. Yeah.
yeah, probably a balance would be the best option.
Great. I also appreciate because I've seen this at the Doctors Without Borders conference, but how you had used how you'd use images, right? So photos that were
Hmm.
shared by your participants in the study, and you want to talk a little more about that, like how you sort of incorporating images into your study.
Sure, sure, sure. So, photo voice was a form of data collection that I employed, wherein I requested the participants to share photographs of whatever that they associated with loneliness and isolation. So, I would ask them this post our interview because they already have such a, rich sort of idea about what we talked about and better clarity about what loneliness and isolation means to them. So, not a lot of them sent me this because uh, many of them were telling me that it's a bit difficult. And when I thought about it, it actually makes sense because loneliness and isolation are very abstract concepts, and not everybody would be able to photograph them. But some of the photographs that I got, the few photographs that I got were of very good, how it substantiated the aspects was on very on top of on a top level. So people talked about their experiences of loneliness and isolation due to an excessive workload. So
Yeah.
um, a nurse sent me this, and then some persons went to so some of them even was able to conceptualize these as ideas, and they took the help of their cousins and friends, made them models and photographed them, right?
Interesting.
So things like artworks. So
Yeah.
going to libraries was
Yeah.
something that gave a person some
Uh-huh.
kind of comfort. That was their coping way. So
Uh-huh.
their friend photographed them in their library.
Yeah.
Another person, for them, when they felt lonely, in order to cope with them, they did artworks. So a person photographed her doing artwork.
Yeah.
Another person made dream catchers when they felt lonely,
Uh-huh.
and they sold it. So this was a way of channelizing negativity into positivity and making money from it.
Sure.
So they shared their dream catchers with me. So this is something that I did during this time. And these are some of the photo voice inputs and the actual inputs that I got. And finally, after doing my whole analysis and my thesis, I did a sort of a photo. researcher driven photography, you could say. It is not related to my thesis in the sense it was not part of my formal thesis document. This is something that I did because I am interested in photography. So I tried to photograph the results that I got through my lens. So in no way would it embody the experiences of my participants. This is how I understand and see it. So that is what I put out during the MSF exhibition. I think photographs speak a lot, Uh, other mediums actually speak a lot. Uh,
Hmm.
Rather than reading a chunk, yes, reading is something that a lot of people relate to, but this is something that you can directly see, or if there is something that you can hear. I
Mm.
think visual medium is a very powerful way of translating your results, and it ought to be explored more.
Yeah.
Qualitative research in itself needs to explore more of these visual mediums, storytelling mediums, for it to be for the findings to be dissipated to a larger audience,
Yeah.
Yeah.
which would then extend beyond just a traditional academic circle.
It's
Absolutely.
also a corroborating evidence that you are not,
Yes,
I mean,
you're not making the stories up.
yeah.
Corroborative is right. I would agree, but I'm just also wondering. I'm with you when Hari, when you say that we need to explore more of these other media because um, of course, the saturation of content in the textual form, right? As in the sense that there's just so much text and um, I'm not even sure it's delivering, right? I mean, I feel like in today's day and age, when we see there's so much of a crisis, particularly in the realm of care, whether it's healthcare or domestic work or elder care, however we're looking at it, there's so much of I mean, a disconnect between the research that is being produced um, and whether it's reaching the people we intend it for. Is it at all intended to reach anybody, or what objectives are they serving? There's so many questions we can ask about the form of knowledge production that we're engaged in today, right, in the kind of neoliberal context. So, in that sense, I'm fascinated by some of some of these approaches that can transcend barriers, and in particular, that's where your photo exhibition was particularly remarkable in that sense because I felt it was able to transcend some of those barriers that we construct in academia, right? Uh,
Thank
which
you.
leads me, in fact, to my question that would you want to recommend for our listeners, our viewers, our readers, any, you know, uh, any other forms of resources on this particular topic? You've mentioned some of the papers that you leaned on, some of the WHO articles that have been talking about this, but other non-conventional sources, if you may, that you'd like to
Oh,
refer. Yeah,
definitely. So,
yeah.
music, movies, and books are something that talks about loneliness from a very, very early period.
Sure.
And some of them, I had actually cited these as references for my literature review because this is a new domain that we are looking at, and sticking to academic sources might not be enough. So movies, definitely a recently released movie called A Real Pain. I think it's available on OTT platforms. Talks about severed ties with one's family, which leads
Mhm.
to loneliness and isolation. Um, you have a movie called Lunchbox, a masterpiece by Irfan Khan, which there is a sort of connection that he has. Two people connect, and how even for a brief period that connection provides a sort of difference in their lives, the kind of positivity. That is something that a
Mm.
Lunchbox, shows. Uh, Bereavement and death, that is very beautifully and very tragically portrayed in a movie called Manchester by the Sea. It's available in Netflix, I guess.
Absolutely.
So
Yeah.
that talks about that. And then, yeah, this aspect of AI,
Mm.
if you've seen the movie Her,
Heard.
Her.
Yeah.
Yeah, so talks about the lack of intimacy and how AI substitutes it. So that is something that you can look at. And then a lot of Malayalam movies, but I wonder whether you'll be able to get the subtitles for these movies such as Alkutatil Taniye, which literally translates to alone or lonely in between a crowd.
Yeah.
And the movie Anandaram, which talks about abandonment, being brought up without a sort of proper care, and finally having isolation, loneliness, and leading to psychosis, right? Uh, so all these are aspects which talk about the negative sort of loneliness. Then you have movies which beautifully portray this being alone or that positive space. So a movie called Perfect Days, that's one of my favorite movies out there, which talks about enjoying little things in life, little moments in life, and uh, being at peace with solitude. So
Yeah.
that's a beautiful movie which portrays that. Into the Wild, which in which he self-isolates. The person self-isolates as a voluntary action
Yeah.
in order and finds out self-sought solitude. And then Secret Life of Walter Mitty, which also goes into, finding the meaning of life, running away from all the chaos and
Yeah.
all these things. So movies, yes, all these are certain recommendations. And I have a lot of books which have been suggested by my participants, but I have not read those, so I am not
Sure.
sure whether I should name those. I'll send you a
Yeah.
list of
Sure.
those books, nevertheless. And
So,
songs, I had some certain QR codes for the exhibition which I had,
yeah, love that.
and I think I can make these songs as well into a playlist, and I can share it with you, which you can then, host if you
That'd be
find it.
lovely. That'd be
Yeah, sure.
fantastic. Thank you.
Okay.
Wonderful. Do you have anything else you'd like to add, or if Shaima wants to chime in at this point? But yeah.
Just one simple point. So this was again regarding what we and what the systems can do in case of this.
Yeah.
And so a lot of coping mechanisms that my participants suggested can be something that can be implemented in the long run. So something like journaling. So people do not know much about journaling. So fostering this habit of journaling and making it more and letting people know that there is a technique which such a simple technique but a powerful technique is something that could be done. And then engaging in positive activities such as so reading clubs and all these set aside, encouraging hobbies and avenues for that, like art, sketches, exhibitions, so all these things, so basically to improve your productivity. So community groups, NGOs, self-help groups can also, there are many groups like I'm not sure about the name, but there is a self-help group in Kerala which engages in these sort of activities and brings together people, even people who are shy, to take forward their activities, especially productive activities. So NGOs and SHGs can also play a role in fostering all these activities. That is something that can be done from a system perspective, not the government system, but the other systems. Yes.
No, thank you for sharing that. Again, plenty to think with in terms of each of
Mm,
these elements, right? In terms of whether it was in terms of thinking about the different demographics and also, when you're thinking about how do we create some of these spaces of collectivities, how do they, how do you shape these for different social groups also, right? I mean, not to isolate or to draw
mm,
distinctions, but also keeping in mind that these spaces have to be accessible for different social groups and meaningful for different social groups, right? So,
mm,
for those who don't have the availability of time uh, for, for say, a hobby, so how do we
mm,
think with it, right? And also, yeah, so much to uh, consider along these lines of how do we respond
mm.
socially, collectively to questions of social
True,
isolation
true,
and
true.
loneliness. But I mean, for me, this has been a wonderful conversation, as I've already shared with you that ever since my conversation with you and seeing your photo exhibit. Um, it's really drawn my attention to this question. Something I feel, it's like some of those moments when you feel like a switch is turned on. It's something that you've not been looking at, and suddenly there's light on it, kind of a thing, right? As in,
Mhm.
so it's also been helpful for me to think with what I see in the classroom, sometimes with students, and not being able to put a label for it. You continuously
Mhm.
grappling with what is it that students are seem to be facing, but I can't seem to put a label or a pulse on it. So,
Mhm.
so actually listening to your research and seeing some of the work that you've been doing was really, really insightful. And I think it also means a lot that, you've from you're of that age group, as I understand from what you mentioned, and then you're also looking at it that casts a particular kind of light, right? As in, you're able to speak from within that space. So all of this has been super helpful. I really hope that you continue this work, because I can't emphasize how much I think it's important. As a teacher, as an educator, I feel this among students that I meet every day. But a space that I feel is very under-examined, although very palpable. One can feel it. It's
Mhm.
very much there, but not really something that has been attended to gets the attention it requires in the health space and the care space. So thank you so much for joining us. Shaima, did you want to add anything?
Yeah, thank you so much, Hari, for sharing your research experience, your learnings from it, and your findings are amazing. Thank you so much for talking to Sabah.
Thank you very much for hosting me. The honor is mine because this needs to be talked about, and only if and I really love the fact that I got a space to, present my findings, and not a formal academic way, but in a very, conversational and casual way. We could build on a lot of things, and really, really thankful to Sabr and Devi and Shaima for providing the opportunity for me to just discuss these. And I am definitely looking to follow this up. And just like all the other domains, even in the academic domain, uh, there are lots of gaps to be filled regarding these. So the next step, and where would I be able to pursue that? There is a sort of doubt in that domain as well. So I guess this topic is totally new to all avenues, and yeah, needs a lot of bridging. And platforms like these are definitely welcome in order to, it's such a boon for budding researchers like me to share my findings with a larger audience. So thank you very much. The pleasure is mine. The honor is mine.
All the best for taking it forward. Really looking forward to seeing this shape up. So thanks, Hari.
Thank you very much.
Thanks. Thank
Thank
you.
you.
Thank
Thank
you.
you, Devi. Thank
Bye.
you, Shaima.